The world faces immense challenges in health. One of the biggest challenges in the 21st century we face is aging populations. At the moment, there are more people aged over 60 around the world than there are under 5. By 2050, there'll be more people aged over 60 on this planet than people aged under 15. Governments are starting to recognize that they need to think about this. So for the first time ever, the G8 hosted a dementia summit in London a few months ago. Healthcare is extremely expensive. It's becoming more expensive. It's actually spiraling out of control. Estimates again say that by 2050, in most countries around the world, healthcare spending will have doubled from today's levels. That is unacceptable. It's just not right. In terms of healthcare as a process and a procedure, it's a complex environment. We're talking about dealing with patients' lives. Potentially, when you treat them, you could put them at harm when you treat them, if you diagnose them incorrectly. In the US today, the third leading cause of death after heart disease and cancer is medical error. Right now, globally, when it comes to doctors and nurses, there's a global shortage of 4.3 million doctors and nurses. If you think about the way you interact with every type of service provider right now, we do so many things online, and yet when it comes to healthcare, we're still having to push pieces of paper around. Why is it that it takes a week or two to make an appointment with your GP? Why is it that it takes a week or two or longer to get your blood test results from the lab? What technologies are there, especially digital technologies, that we can use actually to help us prevent getting sick? So Skype. Most of you have probably used this for making telephone calls, video calls with your friends and family, for business. So in the UK, in Staffordshire, there's a hospital that has just put forward a proposal to use Skype video calling so doctors can see their patients remotely without coming to the hospital. They estimate that this would reduce the number of outpatient appointments in that hospital by 35%. On top of that, if this scheme goes through in that hospital, it will be the first hospital in Europe to use Skype for using Skype to let doctors see patients. What does that mean for an island like Guernsey, where often I've been told people have to leave the island and they fly to Southampton, a 45-minute flight away, for medical treatment or to see a specific doctor? So startups. In terms of innovation and in digital health, I'm not seeing that the innovation and the technologies are coming from large organizations or large companies. I'm seeing actually there's a wealth of innovation coming from startups. And actually, there are startups coming from the unlikeliest of places around the world. The world, I believe, is moving from a unipolar world where we think that Silicon Valley is the home of all the startups to a multipolar world, where potentially Guernsey could become a digital health hub for startups. My experience with startups is in the last 2 years. I quit my job a couple of years ago. I was looking for something to do. As a volunteer, I started a community, a chapter in London called Health 2.0 London. I just wanted a place for people to gather together and discuss issues. How can these technologies help? I started off with 5 people in a pub in London. That was 2 years ago. In the last 2 years, I've been running monthly events, been spreading the word, getting different people along. I've now got over 600 members in 2 years. We've run monthly events covering dementia and technology, Parkinson's and technology. And we've even attracted sponsorship from the UK government, so they're paying for the cost of these monthly events in terms of the venue and the food and drink. Because the real magic when you build those communities that I've seen is actually seeing an 18-year-old app developer talk to a clinical research fellow from a university who's then also speaking to head of innovation at a pharmaceutical company. And it's those conversations that wouldn't normally happen. That's where the magic happens. That's when those new ideas come through, new possibilities. So wearable computing, wearable technology, you'll be hearing a lot about this over the next few years. So with wearable technology, it's really about the fact that we're going to be seeing we're going to see this transfer from mobile devices to actually computing on the body. So I'll give you an example. I was at an event this week in London, and I met a startup from Bulgaria. And what they're doing is they're developing an insole in your shoe that can monitor in real time and send the data to your phone, to the app, where pressure is going in your foot as you walk. It's actually designed for runners to help them improve their running style. But I spoke to them and I thought, how could that be used with older people? What if it could actually be used to help understand, is an older person actually at risk of falling? Why is falling so important in health of older people and in terms of costs and outcomes? Because actually in the UK, 40% of ambulances that are called out to the homes of over 65s are due to falls. So again, imagine the potential impact of this one little piece of technology from Bulgaria if it goes through. It's just a prototype at the moment. Now, when I spoke to this young man from Bulgaria, I said, what makes startups unique in Bulgaria compared to, say, in London or San Francisco or New York? Because I'm curious about startup ecosystems. He looked me straight in the eye, spoke from the heart and said, it's our spirit. So again, in Guernsey, what about the spirit you've got here, what you've done in the past, what you can do in the future? You're going to be hearing about the Internet of Things. What is the Internet of Things? The Internet of Things is literally this vision that many people have at the moment where everything will be connected. Smart homes, smart cars, even smart pills. Those are being tested right now. Smart vending machine. I saw a concept a few months ago. Imagine you go to your vending machine and it recognizes who you are in this new age of the Internet of Things. It also knows through data that you haven't slept much last night. It also knows you haven't walked much this week. It also knows from your medical records that actually you've got high cholesterol. You go and click, I want a chocolate bar. I want a fizzy drink. And actually, the vending machine in this new world says, actually, maybe you want a coconut water and a granola bar. How would you feel that a machine in the future knows more about your health than you do? But that's a world of possibilities where we're heading. Toilets. They're pretty dumb, but we're talking about a future which involves smart toilets, smart fridges, and I'll give you another scenario. You wake up in the morning, you go to the bathroom, use the toilet. Your toilet is smart and it analyzes your health. Then it's linked to your smart fridge, which knows what you've purchased, what you've used in terms of food and drink in the fridge. By the time you get to the breakfast table, the app on your phone that's connected to your smart fridge and your smart toilet tells you what you should eat that day to stay healthy based upon that data. Again, how intrusive is that? How welcome is that for people? There's a leading pioneer in digital health called Dr. Leslie Saxon. She's a cardiologist at the University of Southern California. She recently spoke at South by Southwest, a tech festival in the US. Her prediction is that in 5 years' time, in the developed world, every newborn baby will get an electronic tattoo that gets stuck on their chest, reads all their biometric data, and beams it in real time, that data, to an app on a phone, which the pediatrician or the parents could have, so you know the status of the health of your baby. Now, in terms of this technology, I've got a little prototype here. It's not mine. A company just made it. It isn't in production yet. But imagine, again, you've got a situation where we're currently talking about wearables, and I'm talking about putting this concept of electronic tattoo to monitor my health. Monitoring my health anywhere, anytime, having that stream of data. Again, we could move from wearables to tearables. It could just be like a Band-Aid, a plaster. At the heart of everything in digital health is data, specifically your data from your body. It's extremely valuable, not just to scientists who are looking to understand how diseases manifest, how they develop, but actually advertisers are interested in your body's data, health data. Pharmaceutical companies are interested, health insurers are interested. Now, recently, the UK government tried to introduce a database covering all the patients in England, 53 million, and wanted to set up a national database with all their medical records from their GP and from the hospital, link them together with the aim of improving patient safety, patient care. Then there was a backlash, actually. It wasn't just a privacy campaign, it was doctors, it was journalists, it was even the average person was suddenly asking, wait a minute, in this new plan that's going through, who's going to own that data about me, who's going to have access to it, and who's going to profit from it? What that led then is the UK government said recently, okay, you know what, we're going to listen to your concerns, we're going to delay the launch of this database by 6 months. Now again, when it comes to the value of your data, there are now in the last year, there are startups, a couple of startups that have been created which are aiming to build personal data marketplaces, not specifically for health data, but all of your personal data, that you can actually put it up for sale. Which company, which organization wants to buy access to your personal data? It's a whole new paradigm, especially in healthcare, that actually could put patients really at the heart of healthcare because they can own and control the data that they're generating from their body. I was at a workshop run by Nesta in London recently, and they had a scenario for us, a future scenario, where if this is going to be the case that we sell our health data to organizations in exchange for money or compensation, what if in 10 years' time it becomes so lucrative to sell your health data via these platforms that people actually falsify their health data using wearable technology because it becomes so lucrative? And again, those social issues about this new technology that are far off in the distance, but we need to start thinking about those now. In terms of the future of digital health, there's a leading thinker in the US called John Noster. He recently wrote a blog post and said the future of digital health is nothing. What did he mean by nothing? If you look at a lot of wearable technology today, you may have activity trackers, measures your steps, you may have a smartwatch that are coming out. These devices are very clunky, they're very crude, you have to charge them up. They don't look very good. So John is arguing that actually for digital health to have a future, these sensors, this wearable technology has to be invisible. You shouldn't be able to see the sensors. They should just integrate with your life, wherever you are in the world. Now, it's all very exciting, this potential future for digital health and what we can do. There's a lot of hype, though, and it's navigating through the hype. So when it comes to healthcare and medicine, the traditional way of actually how medicines, how diagnostics reach us as patients is evidence-based medicine. Peer-reviewed evidence in medical journals, and then it's evaluated and reviewed, the risks and benefits are weighed up, and then it reaches us. A lot of what's coming out in digital health is just reaching us, and what we need is we need evidence-based digital health. Also, when it comes to the hype, for example, this is really interesting in terms of, I can talk about it later, but this electronic tattoo that potentially is coming in 5 years' time, at the moment there are major challenges in terms of how would it be powered when you don't have batteries that small and you stick it on the skin? What about the signal-to-noise ratio from an engineering perspective? How's it going to filter through all the electrical impulses in the body? So there are important questions to ask. The road ahead seems unlimited, but these are big, big questions. Things about privacy, things about security of that data. Think about actually the social implications. What would it mean if certain people didn't have to visit their doctor and they could do it over Skype? I read somewhere that actually there's a small proportion of people in the UK that visit their GP because they're lonely, not because they have a health issue, they just want to talk to another human being. So what does this technology actually mean for us? How is it going to benefit us, but how it actually could alter our social fabric, how we interact with each other, how we interact with physical hospitals? Will we even need that many physical hospitals? What if we can do a lot of diagnostics at home? What are the implications? I also want to stress that when you're here in Guernsey thinking about how you can get involved in digital health, to remember that ultimately we're here for the patients, not just patients here in the Western world, but globally. There's people everywhere that need our help. And that also I firmly believe that technology is here to serve us, not the other way round. Now, When it comes to Guernsey and how we can use digital health technologies to make Guernsey the greatest place to live on earth, I believe there are an abundance of opportunities for Guernsey to make an impact in the world of digital health. So, would you like to become the world's leading hub for digital health startups? Do you want to stimulate that growth in the world? You could do that. Do you want to be the leading place for people in the world to come and test their digital health ideas and concepts with 60,000 people here? Or do you want to be the place where ideas are generated that through these new inventions, somebody from Guernsey could develop something in digital health that impacts the lives of 7 billion people? My final message that I want to say to you here today in Guernsey is, wake up, Guernsey. The world needs digital health. The world needs you. Thank you.
Thank you, Maneesh.